Imagine this. There's an outbreak of a deadly disease somewhere in the world.
Influenza,
West Nile virus,
malaria,
bird flu,
swine flu,
cholera,
whooping cough.
MERS-CoV. The disease is spreading.
When will it arrive in the U.S.?
What should we do to protect the public?
Lives are depending on this.
MIDA stands for the Models of Infectious Disease Agent Study. It's funded by the National Institutes of General Medical Sciences within NIH. And its purpose is to develop the science of agent-based modeling, specifically within the area of infectious disease transmission.
We study how infectious diseases spread across populations and how we can use computational methods to protect people from the impact of those diseases. Understanding and having access to the data that the American Community Survey provides to us, it is absolutely fundamental. It underlies what we do.
An agent-based model attempts to simulate every person in the study area, every person in every household. It works on a micro level. My role is to find data or generate data that supports the models. For example, the American Community Survey data and also the 2010 census data, and we use that to generate what are called synthetic populations,
household or age,
which are geographically specific data that represent each household and person in the U.S. There really is no other data set in the U.S. that provides both the level of detail and the timeliness that the ACS provides.
We can run thousands and thousands of epidemics in an afternoon using a computer. This is synthesized, it's not your real data. And then we can figure out who got sick, who didn't, who transmitted a disease to somebody else, and what the impact is over a period of time. We want to know the impact of a disease at a very granular level in order to anticipate what the economic consequences are, what the consequences are for our health, what the consequences are for schools, for children, for the elderly, and so on.
That idea of an experimental platform to test out different scenarios is where the real power of these models comes into play. The ACS really provides the fundamental source data that you need to generate these sorts of explicit, accurate synthetic populations. But the real intent of these is to provide information to policymakers so that they can make better decisions about whether it's resources, preparedness, establishing policies and procedures in emergency situations.
We need to know how households work. We need to know all of these details about people and about communities in order to understand how diseases spread. That's why the American Community Survey is so important to us.
The real point of all this work is to help reduce disease by being prepared to deal with them should they occur.
So as you can see, biostatistics and epidemiology are very closely related. Epidemiology is the comparative study of distribution and determinants of disease frequency in human population. So distribution just means that patterns of disease within or across defined population. So this is kind of our descriptive statistics that we'll be talking about this semester. And then determinants are factors that influence the prevention, occurrence, control, or outcome of the disease. And these would be the inferential statistics we'll be talking about much later in the semester. So if you're interested in EPI or you haven't taken EPI yet, this website, pitt.edu, their super course is really fantastic. So the link is that biostatistics plan and collect analysis of surveillance, survey, program, policy data, and permit valid conclusions to be drawn in order to confirm or refute assertions. So statistics are critically to help practitioners identify factors associated with health conditions, as well as evaluate effectiveness of different intervention, treatment plans, prevention programs, and policies that have been created. The role of biostatistics in the public health field has kind of developed over the past few years. The Institute of Medicine has a consensus of public health reports. The Future of Public Health and the Future of the Public Health in the 21st Century are two documents that outline core functions of assessment, policy development, and service assurance. The three major parts that biostatistics function in each of these is assessment, identifying issues related to health and populations and the magnitude of that impact. A lot of times this will be referred to as a needs assessment. Developing policies where you prioritize what needs to be made into a policy sooner or later, as well as identifying interventions and preventative efforts that will assist in that policy development. And then finally, service assurance, which allows you to ensure appropriate and necessary services are in place in order to reach the goals and monitor outcomes of those programs and interventions, as well as for policies that have been developed after conducting that needs assessment of the community or population you're looking at. So why do you need to learn about statistics? Well, statistics are used in every day to support assertions about health as well as interventions and preventative efforts. Media often summarizes peer-reviewed journal articles to describe how factors, relationships, the community, environment, and other factors, including access to care, impact our health. But understanding how statistics and conclusions can be drawn from these studies is critical because a lot of times the media doesn't necessarily portray the whole picture of the research that has been conducted. They're just pulling out one or two minor things that were found, where we need to give everyone the whole picture so that we can make the best decisions. The two major types of statistics that we will be talking about are descriptive and inferential. So we'll start out with descriptive statistics, which are organizing and summarizing sets of data to help describe attributes of a group or population. So this will be the number and percent of different racial groups, or the number and percent of male and female in a population. Additionally, it would be the mean or average and standard deviation of age in a group. Some of those are examples of descriptive statistics. Inferential statistics go further than just describing that population, and they investigate a hypothesis about that population using information contained from a sample. So we're trying to reach conclusions about the population based on a sample of information. So this would be trying to predict if there's a significant difference between two groups of individuals who one group is smokers and one group are non-smokers, and we're trying to see if there's a significant difference in rates of lung cancer between those groups. That would be an inferential statistics question.